Live. Okay, we are going live. Wonderful, and we are live. Thank you everybody for joining us here today. My name is Fabiana Bacchini. I'm the Executive Director of the Canadian Premature Babies Foundation. And as all education sessions and peer groups have been suspended in hospitals and communities across our country, we are bringing education online for you by doing Facebook Live twice a week with experts from around the country. So every Monday and Friday, 1 p.m. Eastern Time, you can join us and send your comments and your questions on the comments box below. And also every Wednesday, you can join Kate Robson, a psychotherapist and mom of 2 preemie girls, on the Drop-In peer group, also 1 p.m. To access the link, as it is for parents only, you can join our group, Canadian Premier Parent Network, here on Facebook, and then you can join the conversation with Kate Robson. And today I have with me Dr. Karel O'Brien. She's a staff neonatologist at Mount Sinai and associate professor of pediatrics at the University of Toronto. She's a clinical teacher and neonatologist at a very busy perinatal center that is specialized in fetal diagnosis and therapy, and also works in the follow-up clinic. She has trained in clinical epidemiology and healthcare research. Her current research has focused on the development of family integrated care, a model that changes how we deliver care to families and their infants in the NICU. And she has recently completed an international trial of this model of care. Going forward, Care is passionate about the importance of including families in the care of their infants and investigating how to best support the entire team, nurses, physicians, and parents to provide this care in a way that improves staff, family, and infant outcomes. Her motto is "Be the change you used to see." Welcome, Karel. Thank you so much for taking the time to chat with us here today. We also bring parents for these education classes, but also a lot of clinicians from around the world. So thank you so much for your time. So I want to start asking you, some people might not be completely familiar with family integrated care. And for many years in hospitals around the world, especially in the NICUs, we've been talking about family-centered care. And you started this study, I believe, about 10 years ago, was supposed to be our 10th anniversary. And this model has already been implemented in so many NICUs across Canada, US, Australia, and some other countries. Can you tell us about the main difference between the family-centered care and family integrated care?
So when we talk about family-centered care, people were talking about the principles of family-centered care. And really, there was no way of operationalizing those principles in the NICU. So when we started with family integrated care, what we're really doing is sort of operationalizing the principles in the NICU and putting them in a way that could work for all families in all NICUs across the world, regardless of what culture, regardless of what resources they have. So that was the idea behind family integrated care. We really wanted to see how we could integrate families into the care team and practice the principles of family-centered care within that care team with parents in the NICU.
That's wonderful.
Family integrated care was also quite different in that we really packaged family integrated care as a way of implementing this model. So we sort of have developed what we call like the IKEA package. You know, here are all the principles of family integrated care. Here are the sort of the stepping blocks that you need to follow to implement family integrated care. And so that we've given those resources freely to sites on our family integrated care website so they can try and operationalize family integrated care at their site. So it was just a different way of looking at operationalizing the principles of family-centered care. And we found that we had to develop this model of family integrated care to do so.
And what I really love about, I mean, there's so many things I love about FiCare, but one thing is the concept of it was created with the clinicians and the researchers and the families. It wasn't a model that was just put the families aside as for them, but it was actually created with them.
Correct. I mean, we really couldn't have done this. We had 4 parents on the development team from the outset, and it was really their insights that helped guide the development of family integrated care.
Karel, and now you published the results in 2018 at the Lancet, and I know the study has shown so many benefits to the families, to the babies who participate in the study. Can you tell us about the main benefits of family integrated care that you published?
Yeah, so the main benefits of family integrated care was it decreased the stress for parents and it decreased their anxiety. And that's really important because when these babies go home, they need to have parents who can actually are not stressed taking care of them, who actually are open and available emotionally to take care of their babies on discharge. So decreased stress in parents is really important in the long term. The other thing is that we actually show that the babies themselves grow better when they're in the NICU with their parents. And remember, in our study, we had a standard assessment of a 3-week period of growth because many of our NICUs transfer babies from level 3 NICUs to level 2s, and we couldn't track the families after discharge to those level 2s. But we're actually able to show with just parent engagement in care over 3 weeks, there was actually improved growth in those infants in comparison to the babies who didn't have parents involved in their care. And growth is an indicator of many different things. Good growth is an indicator of better cardiovascular stability. It's actually a predictor of better brain development and better neurodevelopmental outcome. So that was a really important piece of this puzzle. So parents are really, I think what it helps solidify, we may all believe that parents are essential to the baby's improved baby care. But in fact, the study solidified that in a really scientific way. Parents actually improve the outcome of babies who are born preterm when they're engaged in their care. And that can continue not just in hospital, but post-discharge. By the parents having the confidence to actually know how to interact with their baby and support their baby's development long-term.
That is wonderful, but also I want to point it out that parents are also very involved during rounds, medical rounds, in the FiCare model, which is, I think, is extremely empowering for families, because when you bring the baby home, we have a brand new team of doctors and clinicians taking care of that baby, and the parent is the one who be empowered enough and knowing how to advocate for the needs of that child. And I think this is such an important piece of FiCare that it certainly benefits my family because we were part of the study at Sinai with my son. And I think that piece of the education and empowerment for parents to be in rounds and participate in rounds and present a baby rounds is such a key. So now I'm going to ask you the difficult question that we all want to know. Obviously, nobody was ever expecting a pandemic at this level. Nobody predicted this scenario, what was going to happen. And we know that NICUs around the world have taken radical steps to protect those very vulnerable babies and the staff caring for the babies, which has caused a lot of stress for parents. And I know here in Canada, in many units, we have adopted the policy of one parent on a 24-hour period, which is much better than many other countries that decide to completely shut the units to parents. What can you tell us? Why was this step so necessary, Karel, for us to have one parent on a 24-hour period policy?
So I think parents need to understand the reason that policy came into place was actually to protect nursing staff. NICU nursing staff and medical staff are a limited resource. There are not many people who are actually trained to do the job well. So as you've seen in nursing homes more recently, if a lot of our nursing staff got sick or a lot of our medical staff got sick, then there may not be enough staff to take care of the babies in the NICU. So the idea was really to decrease the exposure of our nurses to people in the NICU. I hate using the term, and that includes other caregivers, such as parents. So the idea we decrease it so that the nurses would get exposed to less people in the NICU and decrease their risk of getting infected. I think it's really important, again, that we've tried to be careful about making sure that we still identify that parents are actually caregivers in the NICU. They're not visitors in the NICU. They're screened as visitors at the entrance to the hospital, and that really was because it was operationalized doing otherwise at the door. However, in our NICU, when parents actually arrive at the NICU, they're then recognized as caregivers in the NICU, and they're provided with the same protection as in the medical quality mask when they're actually in the NICU to take care of their baby, which decreases their risk of exposure from a nursing staff. So we're all in this together. I think nobody wants to lose large numbers of our nursing staff to this infection. At the similar thing, we don't want to infect parents who are coming to take care of their infant in the NICU with this infection. So I think that respects that sort of circle of we're all trying to decrease the exposure of each other to this infection so that we can all provide the best care for your baby in the NICU.
Absolutely. So given this scenario, and one parent can still come to the unit, can still participate in the baby's care, what can they do at this time? Is the family integrated care in terms of parents still caring for the baby the same, or is anything that they can be done differently that is still going to get involved and still get all the benefits that you mentioned before when you talk about the result of the study?
Yeah, absolutely. So parents are still a really critical part of their baby's care, and just because they're not there for that you don't have two parents, or they may not be there for as long, doesn't mean that they can't contribute to their baby's care. One of our mottos as we finished the study and went into sustain the model of care is make every moment count when you're with your baby. So parents can do something for their baby that nobody else can do. And those are things like holding skin to skin. Those are things like talking and reading to your baby. Those are things like providing your scent cloth to your baby so that your baby has your smell, even when there are painful procedures being performed or when your baby needs to sleep. So these are all things that parents can do regardless of how long they are in the unit. But one of the things I think is really important, it's communication with the staff is also, we know is important in family integrated care, and I think it's really important in this time as well. So that communication with the staff around when you are coming in so that you can make those moments with your baby count. Planning the time that you're going to hold and working with your staff to facilitate that. Planning the time that you're going to bring in your milk, taking home your scent cloths every day and making sure that they're brought back to your baby and changed. Not being afraid to advocate for your baby if you, for example, have not received a scent cloth or you're having difficulty getting your milk into the hospital. Those are things that you need to talk to the team about how they can be better addressed at the hospital level. I think one of the other things is that as Fabiana mentioned, rounds were a really interesting piece of family integrated care. When we started the study, we did not know that rounds would be so important. And yet what we learned in the study was that parents' contribution to medical decision-making at rounds was really important. And that parents often are better observers of some things of the baby's condition because they're with the babies every day and they notice very subtle changes. So the question is, and it came up in our unit, is how can parents participate in rounds if they cannot be there? And one of the things that we've been doing in our hospital is we've been working with OTN to facilitate that parents could actually video conference into rounds. So that's something that some hospitals I know have looked at, is whether they can use some video conferencing or a model of video conferencing with parents, either to engage both parents in decision making, but also perhaps even to engage parents in rounds, depending if that was available at your facility.
That's wonderful. Karel, are parents receiving extra education at this moment on how to, at least infection control? That's something that would be very important at the moment. Is there any extra piece of education that can be delivered to parents in the NICU?
So absolutely. One of the things is that we've developed a handout. Some of the hospitals have developed handouts for parents about the current situation so that parents actually can have something written to tell them how to work on infection control. I think basically for parents coming into the unit, the rules are the same as for everybody else in the community. It's going to be every person that you have been in contact with outside the hospital is somebody that you are bringing in that exposure into the hospital. So again, it's safe, physical distancing. I don't like to call it social distancing, physical distancing. And physical distancing and good hand washing are really the most important things that you can, as a parent, do when you come into the hospital to decrease the risk of exposure of our nursing staff to anything that could come into the unit, and decrease your risk of getting sick and bringing something to your baby.
Absolutely. We have a question here coming from one of the participants. Is there any statistics in your unit or elsewhere that shows if NICU nurses have been infected? Not sure if aware of any.
So no, there are no published statistics about NICU nurses being infected, but they're no different than any other person in the community. The hospitals are probably safer than the general community because, as you know, there's a screening that every person who's coming to work has to go through. So you're not more at risk of getting infected in the hospital per se. That's not the issue. But everybody who comes into the hospital has to go home to their families, has to go grocery shopping at some point. So they're at risk of the usual societal exposure rather than specifically to the hospital. Hospitals are really safe places right now because we know that there's that intensive screening going on before you can enter them.
Absolutely. It's safer to go there maybe than go to Costco and wait in line for an hour to get in.
That's exactly.
Karel, I have another question because, you know, the Canadian Premature Babies Foundation is very active globally with other parent organizations, and we've been raising some concerns among our organizations that once this pandemic is over, it will take a lot of time for units to bring back the parents, for us to continue this work in collaboration with parent organizations and parents being at the bedside and fully engaged in the care of their babies. What are your thoughts around that? Is this something that we should be concerned, or is the time that we have to sit down really together at the table and discuss how we're going to move forward once this pandemic is over?
Yeah. So first of all, to reassure people, I really don't think it will take a long time to return to our progress in family integrated care when this is over. I think if anything, I think we've realized that there were certain flaws in the system thinking that need to be addressed going forward should we ever have to face a pandemic like this again. I think my belief is that it's really important to explain and engage parents in decision making that actually protects their baby, and that we're all on the same page. There's no parent here who doesn't want the nurses to stay well, and there's no medical or nursing staff who doesn't want the parents to stay well and who doesn't want the best outcome for our babies. So I think I think in fact that perhaps this is sort of going to give us more ammunition going forward and remind us of the importance of engaging parents in all levels of decision making, so we don't end up being in disarray when we face crises like this, that we work through them together. So please, I know that this is really hard right now, and I know many hospitals may not have done this in the best way. Many healthcare organizations have not done this in the best way. But we can't move this forward. I really believe that family integrated care can be moved forward. I really believe that people do understand that parents are important to the well-being of their babies. And I just think we need to be patient while people are responding out of fear right now. And we will get through this and we will be better for it.
Absolutely. Thank you, Karel. One more question came privately here. Moms who are tested positive and cannot be with their baby, should they be concerned about baby's development for those weeks that mom you're going to be missing oncoming, or do skin to skin with their babies?
That's a really tough question. I think what's going to be most important, so first of all, mom needs to get well. So, mom's health, if we need to get mom well, so that's really important. Babies, prior to this, and if you look back 20 years ago, there were strict visiting policies in all hospitals, and a lot of babies were not held by their mothers. And a lot of those babies are still normal. So one of the things I think that's going to be really important is that sense of self-confidence and that sense of knowing that you are this baby's mother and developing that confidence and skill to interact with your baby on discharge, even if you have missed out on the NICU, is going to be a really important part of taking care of your baby on discharge. So no, don't worry about things that we can't change, I suppose. So mothers have to get well, dads have to get well. This is what we have to go through right now. The things that you can change, though, are making sure, one, you know what's going on with your baby. Two, that you actually try not to stress or be too anxious right now about what's going on. And when you do get to interact with your baby, that you feel confident that you know what's the right thing to do and that you spend lots of time with your baby at that time. And that you really have to take care of yourself mentally and emotionally, so that when you do get a chance to interact with your baby, that you can be there for them and that you can really be confident that you're the right person doing the right job.
Absolutely. Karel, also breast milk if a mom is positive, is breast milk still a safe thing to do? Because we talked to Dr. Michael Narvi, I think a couple of weeks ago, and the Canadian Pediatrics Society had just released the guidelines. It still remains? Is it still safe?
So those currently are the guidelines. Breast milk is still best for the baby, even if the mom is COVID positive. The other thing is that we know that breast milk will definitely have antibodies against the virus. And again, so that's a really important piece of this puzzle. So yes, breast milk is still safe unless we get some other information. And for some reason, we know that babies, term babies particularly, seem to be very resilient in the face of this infection, and there's good reports that babies actually do pretty well even if they do get a COVID infection.
Okay, is there any case that we know of in Canada of babies who were born preterm?
I can't hear you, Fabiana, sorry.
Is there any case that we know of babies who were born preterm who have been infected?
I don't believe there's been any reports of that yet in the literature. Yeah.
Okay. Karel, as the curve starts to flatten, which I hope is going to be very soon, is there a plan in place to allow the father of the partner to come and be with the mom by the bedside? Or you're not there yet?
Yeah, I don't, the issue is the physical distancing is not going to go away, I think, until we can actually have either a way of testing for coronavirus infection that's rapid, that can be done, daily if needs be, for example, or that we can identify people who are already immune. So I don't think flattening the curve is going to change practice unless another number of things line up to facilitate that. The reason is so if you bring in one person in the unit, every person that person has been in touch with they're exposing the nurses to that. If you bring in two people, again, the idea is that you're doubling that exposure. I think that's something we really have to think about. If both parents could be are in one house and have no other exposure to anybody else, and you can identify that at the door, and you can really bring it. That's something I think that needs further discussion. But there was things that were easy to do, and there are things that are hard to do. And I think we need to just keep our eye on what's going on now and see where we can go in the future. I don't think we're sure.
Okay, so thank you, Karel, so much for joining us here today. You always have great information to share with our families. I really appreciate your time and all the work that you're doing and the work that Sinai is doing here in Toronto. And for you at home, please stay connected with us through our social media channels. We will be back with another Facebook Live on Friday with Dr. Rebecca Hoban. She's a director of the breastfeeding clinic at Sick Kids Hospital, and she can answer all your questions and concerns about breastfeeding and pumping. Then NICU. It's going to be 1 o'clock again here on Facebook. And Wednesday, Kate Robs will be hosting a peer group. You have to join the Canadian Preemie Parents Network group on Facebook, so you can have access to that group. So thank you so much. Thank you, Karel. Thank you, everybody. Be well.
Thank you.
And I see you on Friday. Thank you.
Okay. Bye.
Bye now.